Now let's look at the top-selling drugs. Now remember, what happens under stress? Heart rate goes up. Cholesterol, LDL goes up. Blood supply to the gut shuts down. Let's look at the top-selling drugs in America. First off, cholesterol, $5.22 billion a year. Heartburn, okay, Prilosec. Okay, now I know what you're saying. Prilosec, isn't that an antacid? And taking an antacid, aren't the side effects depression, calcium deficiency, iron deficiency, and muscle aches and joint pain? Yes, I know, but that's okay. We'll talk about that later. It's good because on the bottom of the list we have drugs to counteract the effects of the Prilosec. Okay, so now here. So we got cholesterol, heartburn, arthritis, depression, and depression. Do you see how those medications can be from stress, and how if you take one of those medications, it can lead to taking another medication? Wow, that doesn't sound good. So now, next time you see the medication drug commercial for cholesterol or heartburn or this, let's think about different effects. Let's think that the body is under physical, chemical, or emotional stress producing more cholesterol. Let's say that the body has some type of stress shutting blood supply down to the gut, so there's going to be indigestion. Let's say the body has some type of abnormal adrenal gland function or abnormal thyroid function leading to excess or leading to depression or depression states. Does that make sense? Yeah, let's look for a more solution. Now this one, I found this, and this is out of Duke University. I know it's real small, but this is a list of the medications that seniors are not supposed to be taking. Now, since seniors make up 13% of the population and they take about half of the medications, between 40% to 60%, on this list are antidepressants. Okay, so seniors shouldn't be taking those. Why? Because we're not quite sure how they work. Antacids. Why? Because it leads to muscle aches and joint pain, depression, and osteoporosis. Medication, blood pressure medications that actually attack the central nervous system. All muscle relaxants. And basically any central nervous system toxins. Yep. So now this, I can give you a copy of this list, but this is out of Duke University. They're saying these medications are negatively affecting our seniors. Now I pulled this up. I wasn't going to give it to the medical doctor that tried to give my mom clonidine, which is on this list, but I'm thinking that perhaps if a little bit more research, that there might be more effective alternatives. First off, let's look at a patient who is taking this stuff. Now, have you heard of fibromyalgia? Okay, now, do you know the blood test for it? Oh, there isn't one. Okay, wait, do you know the CT scan or the MRI? Oh, there isn't one. Wait, you mean there's no definitive test other than tender areas that show that you actually have it? Wow. Okay, so that's a tough one to diagnose. Do you know the cause of it? Oh, so we don't know the cause. Do you know the cure of it? Oh, it's supposed to be incurable. Okay, now we talk an entire hour on this, but understand this is one of the most frustrating conditions ever. We don't know how to diagnose it. We don't know what causes it, and they're telling you it's incurable. So now, you're under pain. What are you getting? Pain reliever. You have muscle spasms. Obviously, look, there's a person standing up straight. Do you think they're going to be in muscle spasm? Yeah, so let's give them a muscle relaxant, okay? Now, pain reliever, muscle relaxant, inflammation, what the heck? Since inflammation is part of the body's repair process, let's just give them an anti-inflammatory for the heck of it. Because they're hurt and it might make their joints feel better. Now, you're taking 3 medications. Are you having trouble sleeping at night? Ambien. The tough part is Ambien and the anti-inflammatories also cause muscle aches and joint pain. Are they happy or sad? Prozac. Okay, now, the serotonin uptake inhibitor, the antidepressants, also cause muscle aches and joint pain. So we're taking 2 to solve those, 3 to cause them. Okay, now, are they think they're taking 5 medications, might have a little upset tummy there? Okay, Prevacid. I know, I just said the Prevacid, the antacids cause muscle aches and joint pain, but, that's ridiculous. This is a human being who's giving you symptoms for a reason. Now, this is a mom, a single mom with 3 kids. She was miserable for 8 years. Finally, someone gave her this diagnosis, and they started to pummel her with 9 medications for 6 years. 9 medications for 6 years. And she couldn't function. Came in last-ditch effort. Here she is 90 days later, no medications, and she felt good. The tough part is she went here, she was only working part-time. Now she has 2 jobs. And in this economy today, she just put a down payment on a house. That's huge. Yes or yes? Okay, now, I'm just saying that there's a different effect. Now, this patient here, diabetes. Now, diabetes type 1 is an autoimmune disorder where the body's attacking itself. Now, this is a young gal. She's in her 20s. Now, since autoimmune disorders, where the body's attacking itself, used to be very rare, but now they're getting more and more common. She was doing 4 insulin shots a day when this was taken. When this was taken here, and you can see a massive change, she was down to 1 insulin shot a day, reduced her insulin usage by 75%. Do you think that will add to the length and quality of her life? Yes or yes? Yes. And this is huge. Just a young gal changing that. So no longer 4 shots a day, down to 1 shot a day. Does that mean her immune system's working better? Yes. Does that decrease the stress? Absolutely it does. So now physical, chemical, emotional stress. Right now, physical stress. Accidents, that's obvious. Lifting incorrectly, that's a no-brainer. Sitting. Do you know that sitting increases the pressure on the L5-S1 disc 5 times normal? What that means is golf. If I said I golfed for 8 hours a day and my back's sore, you'd say, well, yeah, it should be. You're golfing 8 hours a day, right? What happens under sitting, you have no genetic defense on sitting. When you look at the side of a low back, there should be a curve. When you sit, the curve flattens out and that reverses those discs. Have you seen people walking around in this type of body posture? Do you know why they walk around like that? Because it's comfortable. Because you're opening up the disc holes and you're actually maintaining that seated posture, okay, if you've been in it for years. And that's why sitting is absolutely toxic to your system. Absolutely toxic to your system. And there's absolutely solutions for that. Birth process is traumatic for 80% of the people in this country if you're born in a hospital. And sedentary lifestyle. That's huge if you're born in this country. Now here, this is a person standing up straight. We're talking about extreme physical stress. Now they developed a surgery over 80 years ago where if somebody had scoliosis, they would put steel rods into their spine, and those are 2 steel rods. Now they generally don't put the steel rods higher than T3 or the 3rd thoracic because typically the bodies aren't big enough to accept the screws. He came in, obviously pain, but he had certain goals. This is him a year later. So he went from a 21-degree bend to a 6-degree bend. Do you see a difference there? Say it with me. Wow! This upset him because if we did this type of correction with steel rods, what could we have done without the steel rods? Quite a bit more. So now this type of surgery, can scoliosis be corrected? Yes. I'm showing you case after case after case. Did God build the body? Yes. Case after case after case. How many people do you know that have a neck like this? How many people? The curve in the neck is the arc of life. For every 1 inch that heads forward, the pressure on the disc double. That's spasming out those muscles. What kind of conditions come from the neck? Asthma, carpal tunnel syndrome, shoulder, rotator cuff problems. All of those are servogenic. They all come from the neck. Should you take a drug to cover it up or fix the neck? Fix the neck. That makes perfect sense to me, too.